tulipoanza miaka mitano sasa kushirikiana.
Majina naitwa Maureen Duku Mtoa kutoka Mtitwandei Ward Provision. Nafanyanga receptionist. Okay. Mimi nilikuwa I was a sex worker. Sex worker ni malaya, nilikuwa malaya. Okay. Mimi nika siku moja nikitembea, chifu akatuambia tuungane na group ya sex workers. Tulikuanga 30, tukaungana. Tukawa tunatoa merry-go-round na pia kuna chama kingine tulikuwa nayo. Na siku moja tukakuja kwa site ya chief. Akatuambia kuna pastor amejenga hii nini. Hakuwa ametuambia kama ni visit. Wakati alikuwa anatuambia kuna nyumba, hajui kama ni hospitali ama ni nini. So akatuambia alituulizia kama tunaweza pata job pale. Alafu ikakaa wakati mwingine akatuambia basi kujeni mkuje mchaguane nyinyi kati yenu watu watatu wanaweza fanya kazi hapo ya receptionist. So wanawake wakanichagua mimi. Wakasema wao hawataki cause wao wanapenda tu wakae kwa ile sex work. Mwanzo walikuwa wanaulizana tutaenda kukaa aje na watu ambao si sex work kama sisi. Mimi nikamwambia mimi nitaenda kukaa na wao. Mimi bado nataka kutoka kwa hiyo kazi. Si chifu nikamwambia, akaniambia sawa, acha nikuunganishie.
Ward Provision first intention of registration was to act as a point where Christian faith meets people's lived experiences. The mission of WPC is to improve the health of the vulnerable through provision of basic healthcare services and the integration of sexual reproductive health and rights and HIV response into strong and sustained community systems within a conserved environment, and this is happening in the eastern region of Kenya. WPC programming is focused on showing the compassionate face of the church through breaking the barriers of stereotypes and biases that have handicapped majority of Christian programs to most vulnerable populations. WPC is currently working in the eastern region of Kenya and strategically targeting sex workers and their clients and the couples through 3 HIV counseling and testing points.
Kwa church yake. Alafu hapo ndio aliniambia training, mambo ya training, nikaenda training. Ilikuwa Masai Lounge Nairobi. Tukafanya training ya 1 week, tukamaliza. After kumaliza nikakuja nikaingia job. So vile nilifika huku wanawake walikuwa wanashangaa wananiambia, "Oh, utakuwa unakaaje na hao wengine si sex worker kama wewe?" Nikamwambia nyinyi mtakaa hapo, mimi tayari nishapata job. Nyinyi kaeni hapo. Sasa walikuwa wanashangaa. Wakikuja kunisalimia wananiuliza, "Wewe, sisi tutakubali kupimwa? Wewe umepimwa Manza?" Mimi nawaambia mimi nimepimwa. Acha ni stigma. Hata nyinyi karibuni mjue status zenu.
And these 3 counseling and testing HIV points are located along Mombasa-Nairobi Highway. The sites are located at Athi River Town in Machakos County and Emali Town and Mtitwandei Town, both of which are in Makueni County. When WPC started in 2003, of course, on the 17th November 2003, when its first HIV counseling and testing point was started, it was intended that the entry point of WPC into health-related matters as a department of Kenya Southern Baptist Convention was through HIV counseling and testing. And to date, HIV counseling and testing remains the flagship program for WPC.
We have data from the last case that was done in 2012, and it shows that HIV prevalence in this country is at 5.6%, and in Eastern Province it is at 3.9%, and also we have data for the sub-county, which shows that the last data we analyzed for this sub-county was in 2011, which showed our HIV prevalence to be 4.2. This data, we collect the data and analyze the data from our pregnant women who attend our ANC clinics. So we are at around 4.2% as HIV prevalence in Kibwe sub-county.
Kuna matatizo mengi ambayo imeletwa na highway. Sasa tukizingatia maneno ya maugonjwa, hii maneno ya ukimwi na virusi na ukimwi, na vile kumekuwa na maafa ambayo yametokana na ukimwi. Vile kumekuwa na watoto hasa wasichana wanaacha shule mapema, wanatorokea town ili kuingia katika business ya sex work.
From 17th November 2003, when WPC started its first stand-alone VCT site in Athi River, a lot has been achieved, including but not limited to the following. Number one, WPC has strategically added other 2 HIV testing and counseling points along Mombasa-Nairobi Highway, and that is in Emali and Mutito and Day Town. 2, WPC has contributed immensely neutralizing stigma associated with church towards those infected with HIV virus, because all of us are able to appreciate in the early and the late 1990s, the church used to believe that HIV infection was a disease that was sent by God to infect sinners. And WPC, as a faith-based organization, it's joining the war against HIV and AIDS as a church organization, then helped and contributed immensely in neutralization of stigma that was in the church then. 3, WPC has courageously set the pace in previously untrodden path of condom promotion and distribution by faith-based organization as a mode of HIV prevention. Number 4, WPC has also defied all odds and is currently swimming against the tides of Christian stereotypes and biases, and doing what Jesus himself would do through working with sex workers in the lower eastern region of our country. Since 2001, or specifically in 2011, WPC increased couple HIV uptake from the 9% its sites were experiencing then to 39% utilization of HTC services. And this was done by couples. And this was done through capacity building of religious leaders in the lower eastern region of our country.
It's been a great journey, an exciting one since the establishment of WPC. Over many years we had only one testing and counseling site in Athi River, but we have seen a growth in our work spreading down the Nairobi-Mombasa highway. We've been working closely with a couple of partners, Liverpool and the government through their tour programs to provide counseling and testing services along the Nairobi-Mombasa highway. Our next big step beyond counseling and testing is providing employment opportunities, especially alternative employment opportunities for people or women who are involved in commercial sex. What we are looking at is a program that will be able to train these people with the skills that are employable. And once we train them on skills that are employable, for instance, front office, computer operation, security services, we are going to be stepping out and seeking partnerships with government and corporates at the county and at the national level to absorb these ladies, because we believe if we intervene at this level where we know that we are reducing the number of women working as commercial sex workers, we are contributing to alleviating HIV/AIDS.
For the last 11 years, WPC has contributed to the national grid on those who are cancelled and tested for HIV and given results to a tune of 159,000 people, 664. And it is important to note that this number that WPC has helped in terms of counseling and testing, 88% of it, which is around 148,000 cancelled and tested, happened through Ungana funding, which was a technical capacity building funding extended to World Provision Center by Liverpool Health between March 2010 and August 2014.
Ni mengi tumefanya kuyawezesha mashirika kujisimamia, kujiegemea na kusimama kipekee, kujiinua na kujiendeleza. Tuliyofanya ni mengi na ni mazuri, but we're looking